Good day, I'm Princess Diana Jindabataba and I will be going to perform the nursing interview in the general survey. So, the nursing interview is very important to us to know what the patient's problem or condition so that we need to prevent that condition, to make it normal for the patient on how we are going to assess her problem. So, but before that, in pre-introductory phase, we need to review the client's previous medical records if available, and also determine the scope assessment needed for a client require necessary equipment. So we have here our alcohol for disinfectant to avoid prevent the spread of our microorganism, and also we have our notebook, pocket notebook for the documentation, and also we have here we have our ball pen to write down, to take note the important documentation of our patient. So in the introductory phase, we need to greet the client politely, and client's companion if around. So, hi ma'am, I'm Princess Diana. Princess, I will be your student nurse for today. If it is okay to you, I'll be assessing the nursing interview and general survey. Is it okay to you, ma'am?
Yeah, sure.
Okay, that's okay. Thank you for answering my question, ma'am. Then, introduce myself. Also, I will introduce myself and verify the candidate's identity. So, may I know what's your name, ma'am? Before we assess the nursing interview and the general survey, may I know your name, ma'am?
I'm Queen.
Okay. Okay. Queen. And what's your age, ma'am?
16
And when is your birth date?
February 16, 2007.
Okay. Thank you for answering my question, ma'am. So let's proceed to ask how the patient would like to be called during the assessment. So, ma'am, I'm here to conduct the nursing interview. I have some questions for you, ma'am, and I want you to cooperate and answer my question to make it clear, ma'am.
Okay.
Then explain the purpose. Also, next is to explain the purpose, an objective of the interview, the type of questions to be asked, and reasons for taking notes. Okay. Are you performing the hand hygiene for the disinfection to prevent the spread of the microorganisms? Okay, next we need to proceed to assess the patient for potential barriers to communication, and we already know the age of our patients. The her ability to speak also, it is a normal. Then provide the client opportunity to ask some questions to her, and discussion is a confidential, and we need to ensure that the privacy of our patient is necessary. Then also ensure that the patient is comfortable by asking some questions, and privacy also need to be confidential. I already said that by interviewing, and establish a rapport with the client. So let's begin to our some questions that we need to answer, that you need to answer, ma'am. I have some questions for you, ma'am, and you need to answer it. Okay, from the relevant information. And here are the biographic data. So in the biographic data, there's some questions in here in biographic data that the patient needs to answer. So, hi ma'am, I'm Princess, and I will be your student nurse for today. May I know your name?
Queen.
Queen. Where do you live, ma'am? Davao City. So, when is your birthday?
February 16, 2007.
What is your age?
16.
Okay. So in the biographic data, this is very important to know the client's identity and the client's information in specific question, and also in specific answer. So we have our working place. So working place, it is a type of interview. Is this a type of interview to the patient? We need some questions about the past and the current situation or condition to our patients. So let's begin the interview with open-ended questions that are allowed full freedom of response. So we have elicited a relevant information on for the biographic data. So we're already asking the patient of our age and how is the feeling. Okay, so how's your feeling, ma'am? How's your feeling? You're feeling right now? It okay?
It's
It's fine. Okay, it's very good answer, ma'am. So this is positive question and positive answer. So we have our reasons for seeking care. So reasons for seeking care, it is an interview of how's the feeling of the client right now, if she have a condition or a current problem experiencing right in a current situation. Do you have a problem or current problem?
nothing.
Nothing? Are you sure, ma'am?
Yes.
Okay. So thank you for answering my question. So next is a history of present illness. So in a history of present illness, what's your history of present illness, ma'am? Do you have a condition or a problem in the past few days or the past few years? Do you have a condition or disease, or what's your feeling right now?
Nothing. It's all okay. Anytime.
Okay. Next, in the past health history. So, do you have a past health history or condition in the past years, past days, or past months? Do you have a problem?
Nothing.
Okay.
There's nothing.
How can I help you?
Just check my temperature or something.
Okay. For the gynecologic and the obstetric history. So, okay. This is a type of questioning about the menstruation or for the pregnancy of the patient. So, as you can see, the patient is single. So, her situation is very normal, and her menstruation also we need to ask her. And next, for the family history. So for the family history, we need to know what's the background of the history of of the patient and her family. Is it have a different diseases? Or like for the genogram, we need to connect from our next and need to we need to come up with the different interviews about the client history, so or for her family history. So ma'am, in your family history, do you have any problem or condition?
Mm, nothing.
Nothing.
Yes, nothing.
Okay, so for the next for the psychosocial history or psychosocial history, this is a type of the psychological history, like for the emotion of what the client's experience of her past or the current situation condition. Okay, how's you feeling today, ma'am? Is it okay, or you have any problem, or how can I help you, ma'am, so that I can assess your problem?
Actually, everything is okay.
Okay, ma'am. So, you're already answering my question, ma'am, and I want you to express your emotions if it is okay to you, ma'am. Do you have any problems or conditions right now? May I know what is that?
I have a
Mhm.
problem condition now in
My
my head.
head. Yes.
Yes,
Oh.
I feel pain every time I stand up.
Oh no. Okay. Every time you stand up, then maybe you you have different stresses, or you have different problem. Maybe you have a different problem, or uh, you know what do you know what I'm talking about?
Nothing.
Nothing. Okay. Um, your your problem is your head. Okay. Your head. You know, mom, that head is very risky part of the body, because there's inside the brain. There's a brain inside that is function the body of a human. Okay, you already know that, mom.
Yes, yes.
Okay, I know. Okay, thank you for answering my question. That I may notice what the problem is, that your head. Okay. Okay. After that, questioning our client, um, next proceed to provide the client adequate time to express himself or herself. Um, so, what are you? How can I help you so that I will give you proper medication? Can you please say something or anything that you wanted to say, so that this um it is okay to answer me Tagalog or English, but I prefer speak you in English. Okay.
What is the question again?
Can you please say something about your problem, or have you any questions or so this here in the social history, we already know how the environment exposing of the different diseases that we don't know, so that I'm going to ask you with the client, our client, if it is okay for her to ask any questions about the social history. um, how's your feeling today, and how's your life now, and how can you help me, mama? You're right here, and I know that you are here to protecting you and give a describe a interview about your condition or problem, so that I can help you to assess it, ma'am. So how's your feeling today?
My feeling today is
Can you please speak louder?
my feeling today is a little bit okay, but I'm here to I'm here to you to check my condition. What happened now?
Okay, thank you. So,
Nagkuan mi ba? Hilong ka! Nagvidyo, hilong ba? Pag
so this here in the social history, the how the environment exposing of the different diseases that we don't know, so that I will ask you with the client part, client, if it is okay for her to ask any questions about the social history. Um, how's your feeling today, and how's your life now, and how can you help me, Mama? You're right here, and I know that you are here to protecting you and give a prescribe describe a interview about your condition or problem, so that I can help you, to assess it, ma'am. So, how's your feeling today?
my feeling today is
Can you please speak louder?
my feeling today is a little bit okay. That I'm here to you to check my condition. What happened now?
Okay, thank you. So,
Nagkuan mi ba? Hilong ka! Nagvidyo, hilong ba? Pag
so this here in the social history, the how the environment exposing of the different diseases that we don't know, so that I will ask you with the client part, client, if it is okay for her to ask any questions about the social history. How's your feeling today, and how's your life now, and how can you help me, Mama? You're right here, and I know that you are here to protecting you and give a prescribe describe a interview about your condition or problem, so that I can help you, to assess it, ma'am. So, how's your feeling today?
my feeling today is
Can you please speak louder?
my feeling today is a little bit okay. That I'm here to you to check my condition. What happened now?
Okay, thank you. So what is your current lifestyle, for ma'am? Do you have any exercise? Do you have or something that what makes you comfortable to you? If comfortable to you?
Jogging like that.
Jogging like that? Okay. So good answer. So how many times did you jog? So say, how did you make that exercise?
Three in a one day, almost
Three times in a week. So okay, and so impressive to know that. Okay. And how's your lifestyle in eating, and what's your meal? Your meal, daily meal, you know.
Vegetable,
Okay.
rice,
Cool. It's good to hear. How many times did you drink water
drink
a
water
day?
every day.
How many times or how many glasses did you um, drink?
8 times.
Okay. Thank you for answering my questions. So next, as you can notice that the patient is coordinating with our interview for today. Next, we need to use some questions carefully and appropriately. That is appropriate questions to our patients. So next, we need to encourage the client. So for this, encourage the client to discuss appropriately to our nursing interview and a general survey. So this is very important as what her daily living. In other words, they assure the health history and the present history. The present history, the past history, and in the present, um, and for us to understand how we can help the client to assess their problem. What else? So use a variety of communication techniques and types of questioning for thorough history taking. So we already answered, the patient already answered our question. May I know your age, ma'am? What's your age? Your age is 16.
Yes.
Your sex is female. So your civil status, it is a your client um, um, married or single, widow. You're single, mom, or you married?
Single.
You're single. Then the impression and diagnosis of the client. So the impression of diagnosis of the client is having a pain on her head. So date of admission is February 16. So the attending physician is the room number is T. Okay. You use the wristband to know the information of the patient. Biological graphic data. Okay. The shift complaint in the health history, we need to know what the shift complaint. So the shift complaint is a problem of her problem in her head, which is pain in head or headache. So the present health status of our patient is the, what is the present health status, ma'am? It is you don't have any present health status. Okay. None. Okay. For the past health history, do you have a past health history, or you have a condition in the past? Oh.
I am.
Okay. Gynecologic surgeries, gynecologic surgeries is mostly in a pregnant woman who are taking a operation which is called the cesarean. So do you have? No. The obstetric history is very applicable to some client or experiencing some cases, which is the history, which is the where mostly this a cases with abortion or any problem related with the obstetric history. Okay, the gravity, none. The abortion, none. None. Yes. Nothing. Okay. Okay, let's proceed. Okay, previous pregnancies we have, yes or no? No. Okay, next let's proceed to physical examination. Physical examination is that type of examination to examine the different vital signs, or to check the vital signs of our patient and other information if it is normal or not. Okay. Okay, the preliminaries here is the blood pressure. So we need to provide a video, which is also, before that we need to disinfect our materials. and we need to apply the equipment, which is the equipment that we use are the by taking blood pressure is stethoscope, sphygmomanometer, the alcohol, the cotton, the tissues, the digital thermometer, and the pulse rate is um, also the hand. You need 3 hands. And for the respiratory rate, here in the abdomen, you need to assess and to feel, palpate, you need to palpate and to feel how many counts of breaths of the respiratory rate of our patient. Next is the height and the weight, the BMI within the ideal body, the less than and more than. We need to specify that. Good day, I'm Princess Dana Tabo, and I will be your student nurse for today, and I'm going to perform the comprehensive health assessment, which is like the nursing interview and the general survey. Is a additional information to our client to notice to know also the main problem, and also some problems that the client need to answer it. Okay. So the name of our patient is good day, ma'am. I'm Princess, and I will be your student nurse for today. May I know your name, ma'am? If it is okay, then is it okay to answer some questions to you, ma'am? Is it okay?
Yeah, sure.
Okay. Thank you, ma'am, for answering the questions. And before that, before we start, we need to know the client's information. This information is very important because the client is here to inform and to share what her complaint. Okay. For that, also, we need also perform the hand hygiene or hand washing. So, as you notice, is it okay? Is it okay to perform the hand hygiene? As I already washed my hand before I'm doing this video. So, hey ma'am, what is your name?
Queen,
Queen Eliza?
yes.
Queen Eliza?
Jane,
Eliza?
Eliza,
Jean?
Izaka.
Izaka? So, for the gynecologic history, is very applicable to our client. But you need to answer, ma'am. Is it okay for you to answer some questions? I have a question to you. Is it okay to answer you, ma'am? And you need also to cooperate this assessment. Okay?
Yes.
Your interval. How many cycles your menstruation? Is it 28 cycle, 32 cycle, 30 cycle? What? 28 cycle. So your duration in your menstruation, how many days excuse me, duration, how many days, the length of your menstruation,
2 days.
okay, 2 days. The amount of menstrual flow, how many napkins did you use? How many napkins? In 2 days? How many napkins did you use?
3.
3. Okay, 3 pads for the last menstrual period. So when is your last menstrual period? So the date there, so in March, in February. So when is in February? When is your last menstrual period? Last menstrual period in February. Okay, you forgot. In the end, expected, you forgot also. Okay. Your history of dysmenorrhea, do you have? Yes or no?
I am.
Okay. Gynecologic surgeries, gynecologic surgeries is mostly in a pregnant woman who have taking a operation which is called the cesarean. So do you have? No. The obstetric history is very applicable um, to our to some client or experiencing some cases which is the history which is the where mostly it is a cases with abortion or any problem related to okay. You use the wristband to know the information of the patient, the biological graphic data. Okay. The shift complaint in the health history, we need to know what the shift complaint. So the shift complaint is a problem of her problem in her head, which is pain in head, pain in head or headache. So the present health status of our patient is the. What is your present health status, ma'am? If you don't have any present health status, okay, none. Okay. For the past health history, do you have a past health history or you have a condition in the past? Nothing. Okay. The current lifestyle you're having, doing exercise, social. Your psychosocial is is it good or bad? What's your condition of your feeling? Is it okay? Little bit okay. Because you're having pain here. You having an headache. In the family history, nothing. You told earlier that nothing. So in the gynecologic history, it is very applicable to her client to know the days or the end of her menstruation. So the menstrual history. So in the interval is um, how many days the your